Hello everyone, I'm Dr. Divya Subramaniam. I'm the consultant of emergency medicine and part of the emergency team of Apollo Hospitals, Chennai. And this is Anish, he's one of our paramedics who is going to assist me today to talk about basic life support. So what is basic life support? So even in spite of our advances in preventive medicine, cardiac arrest seems to be the leading cause of death in most parts of the world. So today we're going to talk about how to approach a patient or a person who has collapsed at home or who has sustained cardiac arrest. Today we will begin with scene safety, right? So basic life support has a few steps that we have to follow. Step one is ensuring that the scene is safe. So when you approach a person who has collapsed in the middle of the road, you make sure that you pull them to the side of the road before you do your assessment. So scene safety is number one. Number two is making sure that the person is unresponsive. How do you do that? So you tap and shout loudly. So when you do that, you give them a verbal stimulus and a tactile stimulus. You touch and you're shouting, "Sir, are you all right?" So if there is no response or if the person is not breathing or has abnormal breathing, then you need to call for help. That's step two. So when you call for help, you can use your mobile phone calling for help, or if there are many people close by, you can ask one of them to call for help. So calling for help, again, you need to call the appropriate ambulance and you need to make sure that the information is transferred to the hospital so that they can dispatch an ambulance as early as possible. Step three is checking for a pulse. So how do you check for a pulse? 3 fingers of your dominant hand you can use. You go through the middle of the throat, which is the Adam's apple, and then you slide your fingers to the side. So when you slide your fingers to the side into the groove, you check for a pulse for less than 10 seconds. At least for 5 seconds, but less than 10 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
If there is no pulse or if you're unsure of a pulse, you then start compressions. So how do you start these compressions? You place the heel of the palm in the middle of the chest, in the lower half of your breastbone. You have to place the heel of the palm and push hard and fast in between the two nipples in case it's a male. Right? So you push hard and fast at the rate of 100 to 120 beats per minute, at least to a depth of 5 centimeters. So you can see that he's pushing down a lot, right? At least to a depth of 5 centimeters and allowing the chest to completely recoil. So that's also important. So you're essentially mimicking the action of the heart. So you push hard and fast at a rate of 100 to 120 per minute. Pushing to a depth of at least 5 centimeters and allowing the chest to completely recoil. So you give about 30 compressions. The ratio is 30:2. So you can give about 30 chest compressions and you follow it with 2 breaths. So the rescue breaths, so if it is a known relative or if it is somebody at home and if you're comfortable, you can place a piece of thin cloth over the mouth and then blow. You need to do a head tilt and a chin lift to open the airway, pinch the nose and blow into the mouth. During these COVID times, if it is an unknown person, we recommend that you do not do the mouth-to-mouth giving breaths. Only CPR resuscitation is recommended. So you continue with 30 compressions and 2 breaths for about 5 cycles. So this way you continue for about 5 cycles. At the end of 2 minutes after you've completed 5 cycles, you do a pulse check again. Okay, so you do the pulse check. If there is still no pulse, you will continue to give 30:2 compressions for 5 cycles. Okay, just to summarize from what we have seen from the beginning. So if you find an unconscious person, an unconscious patient or a person who has abnormal breathing or absent breathing, you call for help. Third step is you check for a pulse. If there is no pulse, you start compressions. Okay. So once you've started compressions, you continue at this rate until help arrives. So if supposing during your third or your fourth cycle, if there is a pulse, you have to turn the patient over in the left lateral position and put them over to the left. This is called the recovery position. Okay, so basic life support helps to save. The more emphasis is on given for compressions and compression only CPR, because the sooner the compressions are given, the more lives you can try and save. We will now do a short demonstration of complete basic life support steps. So let's assume that we are standing in a bus stand and this person has suddenly clutched onto his chest, saying he's having chest pain and he is suddenly collapsing. And I am the first responder on the scene. So, sir, are you okay? Sir, are you okay? There's no response. Anish, can you please call for help?
Yeah.
Checking for a pulse. 1, 2, 3, 4, 5, 6, 7, 8. There's no pulse. Can you start compressions?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 29, 30.
So this is his fifth cycle. Fifth cycle, Dana. Okay, so 5 cycles have been completed. Now I will do a pulse check again. 1, 2, 3, 4, 5, 6. So there's no pulse. So we will switch, right? So because he's done 5 compressions, I will continue with giving chest compressions. Okay, so for the benefit of everyone, during these COVID times, it is highly recommended that only compressions are given and no breathing, mouth-to-mouth breathing is not recommended. Only compressions until help arrives. So until ambulance arrives, and they can use the defibrillator to check the rhythm and give a shock if the patient needs it. Thank you.